It sounds like prison to me for old folks.
In a way it is, especially the public ones, because they got their rooms, they come out, they have their meals, they do their activities, they come back in their rooms.
I already been here. I feel like the stars are all aligned. I don't even know fear. I just wanna take my time and grow like a rose. Just know that I ain't never gonna stop. I'm like a rose trying to grow. Just know that I ain't never gonna stop. No.
Welcome to Distinguished Gentlemen. I am your host, Deshaun, and I am here with a lovely guest, you know what I'm saying? However, on Distinguished Gentlemen, when anytime I feature somebody, I like to call it undefeated mind, you know what I'm saying? So with that being said, let me introduce this young lady. I want to introduce her for sure. She's been working with me for almost a year now, 2 years now.
2 years.
She's one of my greatest clients that I've had so far. We've dropped 20 pounds, you know what I'm saying? This lady has taught me a lot about myself and also with training with her, excuse me. You know what I'm saying? The one and only Whitney Miller.
Thank you. I like that intro.
Love the intro?
It was nice.
I'm working on my introduction.
Yeah, that's pretty good.
As a gentleman, we're supposed to be able to get good at introducing somebody.
Oh, you did a good job.
Thank you. I appreciate it.
Where we at?
So I got you here. You are actually my first lady on the pod.
That sounds good, First Lady.
First lady. You're my first lady on the pod. I have so many different women want to come on the pod. They want to challenge my perspective, however. You know what I'm saying?
You better be careful what you ask for.
You better be careful what you ask. You know what I'm saying? So I really want to bring you on here because of your career path.
Okay.
But before we get into your career path, can you tell me a little bit about you? Where are you from?
Okay, so as Deshaun mentioned, my name is Whitney. I am from Palaco, in Florida. You see that Florida accent, you know, everybody can't say it right. You got to be from the down south to say it right. But small country town. Raised with both my parents in the household. I'm the oldest of three. And since we're talking about my career path, I've been in my career path since 2010.
What do you do?
So right now I'm a nurse. I am a manager, clinical leader in a CCRC setting, which is like a nursing home, but it's a retirement center, a continuous care. So the distinguish between a nursing home and CCRCs are a little bit different from what I'm used to, basically from state to state.
Okay, so each state is different.
Yes and no. So Florida don't really have a lot of CCRCs, which is a continuous care retirement center. We have more so nursing homes. Nursing homes is more so for Med-Aids and Medicare people.
Okay.
But CCRCs is more so an investment in your retirement. And there's a lot in North Carolina.
Investment, so that's where the money is.
That's where the money is at. All the residents there is private pay. So
Private pay. So it's not public.
It's not public. So public is more so like Med-Aid and Medicare, where state pays for a lot of things. So that's where you get nursing home. But CCRCs is strictly private pay.
Okay. So you work with people that got money.
We got money. We got money. Chase the money. Chase the money.
Okay, since you saying that, this distinguished gentleman, however, you shouldn't be undefeated. You saying that, what is the demographic in there? Are you allowed to say that? Like, what's predominantly?
No. But I will say, as a culture, we need to do better with our future endeavors when it comes to what we want to be at when we retire. A longevity, investing in continuous care, because we can't expect for our children to take care of us once we become old.
So you saying basically, money's turning a lot of us not here?
Nope, at all. Nope, and it's sad.
But this is the private spot.
This is
it's
the
a lot
private.
in the public spot.
It's a lot of in the public.
So in the public spot, correct me if I'm wrong, that's when they wipe your butt up real aggressive.
Real aggressive. And
You
don't
can
give a
leave
care.
there
Yep.
For about 7 days without taking a shower.
So, exactly. But it's more so no one's there consistently to take care of you. So, that consistent care that you want for your mom or your dad is not there in public because nowadays it's more so agency nursing and caregivers are coming into these spaces because they can't keep a steady flow of staff employment. So there's no consistency in the care.
So comparing it to like public school and private school.
Exactly. Exactly.
So we're going to you investing in yourself long term will pay off for you if you invest into yourself long term. We not in there because a lot of us don't invest into ourselves long term.
Exactly.
We invest into ourselves short term.
Mm-hmm. Mm-hmm. And then with us, we have a lot more long-term care issues. So with us in these public settings, we are giving them more money to build our insurance.
Mm-hmm.
So it's less for us to maneuver when we need to.
Mm. Man.
When it comes to diabetes, hypertension, amputees, which means cutting off of your legs, limbs, whatever, and just stuff like that.
All right, so let's talk. When you saying that, let's talk about some of the main things that you see in the elders that we need to prepare for as far as health wise. Because you hear about Alzheimer's. As we get older, we start to lose our memory. But basically, what you said, there's some things worse than Alzheimer's that a lot of older people run into.
So
What's one of the most common things that you see that a lot of old people run into?
and just our culture or just in general?
Just start in general first and then go to our culture.
Okay, in general speaking, a lot when we get older, we have a lot of blood sugars issues. So your body not releasing enough insulin, which I feel like it's going to be in a high rise because of the weight loss issue that's going on now with this Ozempics and all this other stuff because it is insulin resistant. So if you're doing that now, only imagine what kind of damage you're going to do for your future self. So that means your blood sugars and everything, your body's not going to be able to produce the insulin that it needs for you to live at optimal level.
All right, so my main audience is me.
Okay.
It's called Esteemed Gentlemen for a reason.
Okay.
A lot of these guys, I'm starting to see a lot of promos for Bluetooth, for hymns, the Rhino pill, that honey cut. The boys started early getting some help.
Okay.
A lot of guys don't understand that that's going to eventually come back and get you. They have erectile dysfunction issues. When them old men get there, do that Peter record still work? You know what I'm saying? Because a lot of these guys setting themselves up for failure.
So the answer is no. The answer is definitely no. A lot of times what I do see is, stop me if I get too graphic, but majority of the time the prostate gets enlarged. So when the prostate is enlarged, it restricts the flow of urine. So if the prostate is being enlarged, and a lot of men have benign prostate issues, which restricts for them to go to the bathroom, which causes them to have a Foley catheter in place for them to use the bathroom for them. So some people have to do a straight cap and straight cap themselves when they have to go to the bathroom, while others who are not functioning cognitively, they have to have a Foley catheter in place and have it changed every 30 days. Now we do have some men who it's called a turtle syndrome, where it just goes in. So you have to lay on your back and push down on it for it to come up in order for your caregiver to cap you.
So your caregiver gonna have to go and clean you up just because you can pee on yourself.
Yeah, they're gonna have to do that regardless.
And that's what y'all take care of in private. In public, they can let them go for a while.
Yes, in public, sometimes more than normal, you will see where a lot of yeast has been developed, just a lot of just issues going, especially with the catheterization. It can embed on their skin, which cause like an indent in the surface. So that would be a wound on the penis or wherever the catheterization is located at. So on top of that, now you got a wound on your most prized possession. And sometimes, like I said, inconsistency of care, it may not be taken care of like it's supposed to be taken care of.
So on the same thing, we talk about hygiene.
Yeah.
I'm huge on hygiene. I'm huge on health too. So when it comes down to basically what you're saying, gentlemen, I'm gonna give you a holistic remedy to keep your guy rocking. You feel me? You need some zinc in your life. Go get you some zinc. 50 milligrams, it's solid for you. Now I'm not, first of all, let me say this. I'm not a doctor. I'm just putting it out there saying basically this is the holistic route that keeps certain things flowing. You feel what I'm saying? Get you some zinc. If you don't want to take the tablets or like the pill form of it, you can take you some pumpkin seed. Get you some Tonka Ali to help you last long. It's basically like a number cream. That's inside the honey pack. You feel what I'm saying? You can actually go get the pill form. Get you some turmeric in your life. It's great for you.
And I'm gonna add, if there's any breakdown, zinc cream is a plus.
Oh, okay.
Yeah, zinc cream.
Zinc cream.
Mm-hmm.
Some zinc cream.
Yes.
Okay.
So yeah, if there's any like breakdown, there's any openings, not because of like any other issues. We're not even going to touch on the STI issues, but if there's any like, you know, maybe your underwear may be too tight on you or something, you can put zinc cream down there if you have any excoriation or anything of that nature. So it's a plus.
Okay. Goat to cola is another one. I know that's a herb that a lot of people don't know about. It's called goat to cola. And also I said zinc, Tonka Ali, goat to cola, turmeric, and it's also one more. If it comes to me, I'll let you know. You feel what I'm saying? But back to that, you said about wounds. Before we go into wounds, though, I gotta get to my ladies too. Can't read your mouth. So, are there some equivalent examples of when men don't work, women work, or women don't work? Because I've heard that women's sex drive go up as they get older, while men's sex drive go down because they testosterone levels.
Right. So we still see women still have the urge to still have sex in those settings. So, what was the question you asked me again?
So basically, like, do women have complications equivalent like how men have complications?
They do. So it's the same thing. It's not as on the same level, but when it comes for, of course, their incontinencies, they can have either redness or they can get UTIs. They can have yeast and all that other stuff. Same thing as they were when they're younger ages, but not as complicated as the males, because when your mind is gone, you can't do as much, and it's much to do with males than it is with females.
Oh yeah.
So,
okay.
As far as the hygiene part of it.
Yohambe. That's what it was. Yohambe. That's in a lot of like fat burner pills, but a lot of pre-workouts. Sometimes it's a good herb. Yohambe is good for you. And goat to cola is a good brain food, since you were just saying like as far as losing like memory and stuff like that. It's a super brain food. In a cognitive blend too. About that guy. I just wanted to throw it out there, herbal side of it, you know what I'm saying? Shout out to my own cycle like a own baby. We got one coming up next. Just hold that thought, you know what I'm saying? But anyway.
You killed me with that.
Listen,
But no, it's good. It's good because in some kind of supplement form, like everybody should take some kind of herbal supplements. Because you can't always go to the doctor to get the things that you need, which can cause harm to your body in the first place. So Yeah. If y'all don't got that, y'all need to get into that ASAP.
For sure. So, speaking of that and just male and female, is there a way you can tell me about the ratio? Is it more women in there or more men, or how does that work?
Okay, so we have a lot more, the women are outliving their husbands, for sure. So I'm gonna give you a little, the stats that I'm working with, I have, out of 20, probably like 3 males. So
Out of 20?
17 women and 3 males, yes.
In all?
And just a little small little segment is what I'm gonna go off of. But yes, when both the spouses are living together, then they are, you see the even split down the male and female. But when they go down to healthcare, and their health has deteriorated, we see a lot more women coming in to see their husbands. But once the males have deceased, which means passed away, when the women come over, they don't have their significant others coming to see them because they already passed. So we do see a lot women than we do males, because the women are outliving the males.
And speaking of that, are the children coming back visiting me?
Some,
Or
not all.
not all?
It all depends on the upbringing. We can tell just by the fluence of we seeing the in and outs of the family members coming in with the kids.
So the parents that had good relationship with their children, those children typically come back. You know what I'm saying?
Yep.
The parents that don't have a relationship with their children, the children typically
They don't see them either once a year or not at all.
once a year, not at all.
So it's like when you coming in and you ain't see your mom or your dad in a whole year, you trying to tell us what to do. Oh no, they don't work like that.
Oh, so you got children that come and try to dictate what y'all got.
Yeah, they'll be like, oh, so and so this and this. Why is she doing? No, you can't tell. We don't even know who you are. Our friends come see you more than we even know who you are.
I said it's like a prison to me. It sounds like a prison to me. For old folks.
In a way it is, especially the public ones, the ones that's Medicaid and Medicare, for sure. Because they got their rooms, they come out, they have their meals, they do their activities, they come back in their rooms.
I think this is something that people should really think about because it's inevitable for you to get there. On average, what age do you typically go, starts to come there? As early as blank, as late as blank.
So as early as 70, they come in for rehab. And then depending on their rehab and the support they have at home, that dictates how long they stay in rehab to switch over to long term or they go back home. But we don't release unless you are safe to go back home.
Like being mobile.
Yes. So if you're not mobile or you can't do the care that you need to perform your ADLs, which is your activity of daily living, then we sit as a team, healthcare, nurses, therapy, the doctor, everybody. We all sit at a round table and we discuss the care for that resident or that person. And if nobody doesn't agree, we work on it and get them a goal. And if that goal has not been met, then they have to stay longer until that goal is met. But it's expensive.
So staying in shape
Yes.
can prevent that.
Yes.
Taking care of yourself, lifting weights, make sure you control.
And going to the doctor. Go to the doctor when you know you need to go to the doctor.
So you saying go to the doctor? A lot of us
Don't go to the doctor.
don't go to the doctor. A lot of us ain't got a good relationship with doctors. Because, like I was saying stuff about the holistic side, you got doctors that'll tell you, something might be wrong with you, but it's really not. They put you on some type of medicine that cause you to be kind of like, you know what I'm saying? They look at you like you a check. So a lot of us don't have a great relationship with doctors.
And that is true.
I think that we still should go, but I think that we should fish for a family doctor so we can continue to go. But a lot of us lack insurance. A lot of us don't go get checked up because we don't have insurance. Now, I'm not saying that, I'm making excuses. Because ultimately, that's what you're saying is inevitable. We all are going to get old eventually. But I like to bring up the mindset of why certain people don't go. I know a lot of people lack knowledge. They're ignorant to knowing what to ask. They're being fear-mongered based off of society and, women in pregnancy and stuff like that, dying from the hands of doctors, the ratio from malpractice is crazy. However, I don't think that we should stop that from going. But I guess what you're saying is the best way to prevent a lot of this stuff is while taking care of yourself.
Yeah, so overall, even if you go to the emergency room or urgent care, go and get some lab work done so you know where you are in your system. That's it. Once you know where your levels are, if they're too high, if they're too low, your cholesterol, your whatever, your thyroid, whatever the blood test is, you need to have a baseline of what you're carrying, so where you are, so that you know how to handle and manage it. And you're already looking for the future on what complications you may have if you don't go to the doctor every year or a checkup every year. That is most important, because say if you have issues with your, so we're talking about catheters and penis and BPH. If you got a prostate issue, you never know if you have a prostate issue if you never had any issues with your urethra. So, and what you're eating is important, because if you're eating a lot of foolishness, you're going to have issues in your kidneys that's not going to be able to deplete anything out through the urine. So it's just those things that we just have to be mindful when it comes to our care, so that when you do go to the hospital, they're not giving you a whole list of things that something's wrong with you. Oh, we done found out you got heart failure. Oh, you got your kidneys is shutting down on you, and you got cancer in your lungs. Like, no, I don't want to know all that stuff when I go to the hospital. I want to know the minimal so I can get on and go about my business. But that's what's happening. People go to the hospital when something happens, and then they have a whole list of things that is wrong with you.
Instead of doing like a maintenance checkup.
Maintenance checkup. And that's it. Just a maintenance checkup.
Because I'll teach people, distinguished gentlemen, in order for you to be distinguished, you have to understand certain techniques. I teach preventative or provision maintenance. You have regular maintenance, and then you have corrective maintenance. So you saying basically a lot of people is in the corrective maintenance because they avoid getting maintenance checkup.
Exactly. Don't go to the hospital when you done filled out and now they done told you type 2 diabetic, and you've been a type 2 diabetic this whole time
And
you didn't know it. Or you lightheaded at this time and this time, because your blood sugar probably is dropping. You can go into a coma if your blood sugar is at a certain level. You can lose a leg. If you got bitten by something and you got a wound and you're a diabetic, your healing process is slow. Which means your leg can get cut off, your arm can get cut off. Your healing process is it's a long journey for you if you're a diabetic. And a lot of people don't know that.
A lot of people don't know. And it's also in their DNA.
Yep.
It can be pre-diabetic.
Yep.
Genetic.
Yep. And some things are reversible, but some aren't. But you also got to know your history, and if you don't know your history, that's why it's important to at least do a yearly checkup on yourself.
Right, because some people can't get in contact with their parents until they grow up. Those kind of people.
Exactly.
And
you can go to the doctor and be like, hey, I need everything. Give me all tips for everything from A to Z, and they'll do it. Even if you don't have insurance, somebody got to pay for it. And after a certain amount of time, I don't know, don't quote me now. It falls off after a certain amount of years. It won't be on your credit. It won't be on your credit. It'll fall off your credit. Don't quote me. So So if you got live it, then you good.
Hey, you gotta do what you gotta do. Hey, I hear you. You gotta do what you gotta do.
But they would never turn down anybody in the emergency. They can't. It's against the law. So
It's good to know. It gets to the point though, where I've noticed that as people get older, they typically go, especially if they don't have a spouse, they typically go to the hospital just for a ticket. Like it could be like the smallest little thing,
Yep.
but because they don't have a spouse and nobody there to take care of them, they in and out of the ER, they in and out of the hospital like it's crazy. Do you see that happening, like being at the nursing home? They just hit the button just because they want some attention.
Oh yeah, for sure. So in the setting that I am in, let me give you a little bit more background. It's like I said, it's a community, it's a retirement center. So a lot of these people are giving up their homes to be into these communities. So you got some communities that have homes, some communities have apartments, and then they have an assisted living. So as they go down in their health, they go down to these different levels of care. So we do have the frequent ones, they have buttons. So it's like one of those I've fallen and I can't get up type of situations. So they'll press their button and we'll come and see and check on them. And it'll be something as simple as, oh, I don't feel good. Oh, I got a cold. Well, ma'am, you're going to go to the clinic tomorrow. Okay, you go to the clinic tomorrow, you talk to the people you need to talk to. We are only here for emergencies. That's it, emergencies. But yeah, we do see a lot of people that person is gone, they need some attention, they call for the littlest things. When they come over to healthcare, they do the same thing in healthcare, call every 5 minutes. So, and even in the hospital too, you got people that come in all the time for whether it's drugs, we call them frequent flyers. So they just come in, they already know, I don't have, what's wrong with your leg now? What's wrong with this? We're not giving you no drugs. Go see your PCP, which is your primary care provider.
You basically gotta treat them like children. Because
Yes.
they go back into the childlike mindset.
Yes.
It's like a cycle.
Yes. Yes. Didn't I tell you? Yes.
Now, I hope y'all don't be mean. Because
No.
we gonna get, oh, somebody gonna have to wipe your
No,
butt.
it's not. It's not that we're being mean. It is more so just reorienting them.
You have to be firm,
Yeah.
assertive about it.
Yes.
Gotcha. Now, let me ask you this. We talked about Alzheimer's a little bit earlier. Those people who have Alzheimer's, are they harder to work with?
Yes. Every day is different. Every moment is different. So you have to be very patient and care with so much compassion when you're caring for a person who has Alzheimer's, because one minute they may slap you, one minute they may get some water to take their medication and throw it at you. They may get their food and throw it on the floor. They may go in their room and poop on the corner of their room. So every day, every moment is different with Alzheimer's people.
Now listen, you just said something that just had a thought. Now mind you, Whitney is my trainer. I train Whitney, so we talk about women in training and women in their pelvic floor muscles. A lot of women, pelvic floor muscles are weak. As they get older, they get weaker. You told me, y'all, this is one of them ones where it kind of like, it was an eye-opener for me. You told me that because of these women are doing what they're doing, especially like OnlyFans girls or being overly sexually active and stuff like that, that their uterus falls out.
Yes.
And there's utensils that has to basically hold it up. Can you explain that?
Okay, so.
Because I don't think that they fully understand what's
Okay.
going on. And also like crazy angle, you know what I'm saying? People like what they like, but
Yeah, especially with that, with the last part you just said, it is very difficult to flush that stuff when it's huge. Like, anyways,
You just had a moment.
Because it's a lot. Okay, so when it comes to the plug, okay, like you said, the uterus, yes, there has been numerous of people whose uterus are completely out of their body. You look and you see the uterus. So we do have, some people do have, it's called like a prosthetic device, which is a prosthetic is a fake, whatever the body parts you need. And it's inserted up to keep the uterus up like a cervix. So, of course, you have your vagina, you have your cervix, and then you have your uterus. So sometimes, if you have a prolapsed uterus, that's the medical terminology. Prolapsed uterus means that this uterus that's up here like a balloon is completely out. So the device is used to keep it up so it doesn't fall out.
So what does that call from?
Multiple children, sexual activities, certain types of sexual activities, and weak pelvic floor muscles. So
Exercise can prevent a lot of that.
exercise can prevent a lot of
Listen, man, check y'all ass to work out. Please don't work out. Squat. What's it gonna say? Squat.
yeah,
Hey,
yeah.
Squat. Y'all need to work out, man. A lot of us we starting to see the run clubs. If that's where we want to start, I applaud you. But we got to do better, especially when it comes to young ladies and squatting. You don't have enough testosterone to be built like a man. You feel me? So.
But even with
Yeah.
squatting, there's other exercises you can do for your pelvic floor.
For sure.
So definitely do your homework and your research and really see what fits you, because there's a lot. You just gotta take care of your body. Just gotta take care of your body.
Mhm. So,
And also let me add, there's nothing wrong. Well, I should say this. Ask your grandma and your great grandma what they used to do back in the day, because they used to have 12 and 13 kids and still snapping it back.
that's true.
So whatever they were doing, it worked. So
Listen, you said a number. I got an episode where I talk about parenting and genetics and how that actually affect us, because we don't know. And we stop doing some of the things that actually work because we were lied to through propaganda. And a lot of people have, subscribed to those lies, and now we're starting to see the result of it. So I really wanted to bring you here because we're at that sweet spot where we still young, but you know what I'm saying, we getting to that age where it's like you gotta be cautious about what you're doing now. So we can still talk to the youth, but we can also still see where our future is at if we don't take preventative measures. You know what I'm saying? So I don't see really too many people talking about this that look like us.
not at all.
That talks about the future of where we're headed. We talk about finances, that's cool. We talk about the little babies where, spiritual saving and stuff like that, and going that way. However, people do get old. And when they get old, they get old. You lose memory, you have health issues, stuff like that. It can be a blessing too if you really take care of yourself, basically. So,
Because you still can move no matter what your age is. I have people who are 100 years old and they're still moving. They're still walking. They're still getting around. Until they say, I'm done, then that's when they're done.
I think a lot of older guys die from stress and also not having a purpose. Like once they tap out, they just be like, all right.
Yeah, once you give up, that's it. It happens too fast. But if you got some fight in you and you gonna fight, yes. Yep. Like I said, I see 100-year-old still walking out there in the morning time. If that don't motivate you to go walking, I don't know what would.
So let me ask you, I don't know if you can answer this, you don't have to if you don't want to. But experiencing the loss of a person at your job, like how was that? Did the room get cold for real? Have you ever seen something like the body, like You know how people be like, oh, I saw the soul leave the body. I heard them take their last breath. They just went and landed. Like, how is that?
So if you are actively caring for a person, you do see the last breath. Like you, especially if you're like doing a bed bath for them. And sometimes those bed baths do take them out. So depending on their transitions, the nurses can know, like we just have that instinct. Like we know when, if we bathe her good and we give her a good turn, that might be her last turn. And of course, there's other factors that's included, like if they're taking morphine, because hospitals have their own concoction of medications that they use. And if they've been on it for a while, we know like tonight might be the night. Like tonight might be the night that she goes. But those baths, sometimes our aides when they wash them up, they do see them take their last breath. Sometimes we go in there when we do our rounds. That's the last time we're gonna see them alive. But to a certain extent, it does play a toll on you until, kind of sound bad, but until you get used to it. Because right now where I'm at, I'm kind of used to it because I've seen death so much. It's like every day somebody's dying, depending on what it is. So I'm at a point where it's just, you know, God bless their souls. We'll go talk to the family members and then continue on with our day. So yeah, it's something to get used to, but we see it more than one.
Okay. Well, I appreciate you for giving insight on that, because that's super important. You know, we can talk about our future, where we headed. And death is inevitable.
It is.
It's actually, I think it's a negative stigma behind death. Death, I think, is beautiful because it goes out with the old and with the new. If some people don't die, we will be in a bigger problem than you think.
Yep.
So I think that, you know, you gotta just pay attention to the dash, the beginning date and your end date. Just make that dash real thick.
And that's the goal, to try to make it as smoothly and peaceful as possible.
Yeah.
And as long as you got everything in place, we're just waiting on you to just release.
All right. So before you go, Kevin Sanders used to say a lot of people gonna die alone.
Die where?
Alone.
Die alone? Okay.
Yeah. That's a real thing, dude.
Yes. Yes. It's all in how you treat people. If you treat people right and you do good by people, people will actually sit at your bedside until you die. Some people will sit there till they'll be there every single day until you go. But more than most die alone. Die alone. And it's really sad. It's really sad to see people die without any family members who have never came to see them, who never participate in care, nothing. The staff is their family, and that's sad. That's sad.
So I look at it like this. People need to, sometimes your family is not the people you were born from, it's the people you deal with. You know what I'm saying? So keep a community of people around you, and that's why I brought her here, you know what I'm saying? Because we build a community over here. We got a lot in store for y'all. I just want to be able to document where we at before we get to where we're going. You feel me? So with that being said, thank you, Whitney. I appreciate the knowledge that you dropped. In order for us to be distinguished, we need to be able to understand how to build a solid foundation. And that matters, because our future matters. So y'all know what I always say, man. Thank you. Together we stand, divided we fall. I'll see y'all in this episode. Holla us out.
Bye.
I already been here. I feel like the stars are all aligned. I don't even know fear. I just wanna take my time and grow like a rose.
Be nervous. How you say it on the movie Life? Don't be scared. Be scared.
That I ain't never gonna stop now.
All right.